So one thing that Ben mentioned is different types of needling, like dry needling. And dry needling, you may have heard of or tried even, and it's a type of acupuncture. Um, so after Ben had someone do some needling on him, he said, "How do you ever use a pistoning technique?" And that's where you're kind of jamming the needle in a bunch of different directions and kind of purposefully beating up the tissue a little bit. And I said, "Well, I mean, I will if I have to, but if I can do some type of an assessment and a stealth intervention with a thin needle and just in exactly the right spot, then I don't have to do that because that's likely, in addition to, treating whatever's pathological in that structure of the body that you're trying to get to, it's also going to damage a lot of healthy tissue, and your body's going to go through a whole inflammatory response. So, like, on, I would never do that to someone who needed to be game ready. If somebody was on injured reserve and they had, a fibrotic tendon that was, really scarred over and thickened. And I might go ahead and do that kind of technique to try and get blood to come into the area and have the body remember that it needed to heal that. But I would never do that to somebody who needed to be game ready because you run the risk of, really blowing something up. So that's why I like kind of the stealth method of using a really thin needle. And I'll talk about some of the points that I'm using in a little bit.